Ka makaia taku kōtaha ki te raki, ki te tonga, ki te uru, ki te rāwhiti, ka tau, ka titia I konei ki te pai o te kaupapa nei, ka tākaia ki te mihi, ka whiua kia koutou e hika mā tēnā koutou. My name's Mihi Ngārangi Forbes and welcome tonight. We're here to help you understand more about children's vaccinations and why it's important for our tamariki to get vaccinated. So given the changing situation with Omicron in our communities, this discussion is even more important. And we know many of you have important questions that you want answered before getting your tamariki vaccinated. Whānau, we have four child health experts with us tonight who can help answer your pātai. We will address as many questions as we possibly can, but we won't be discussing individual whānau situations. If you have one of those, it's best that you talk to your GP or your family doctor about that. We also are aiming for informative, constructive and genuine questions, so we won't be addressing mis or disinformation tonight. And just be aware this session is being recorded so we can upload it later on tonight for other people to listen to. So now, let's meet our panel. Nō te aupori Ngāti Kuri, te rarawa me Ngāpuhi, tāku tā Hinemoa Elder. She is a child and adolescent psychiatrist. Tēnā koe. Over the pandemic, our community and developmental paediatrician at Starship, Dr. Jin Russell, has provided independent expert advice to the Ministries of Health and Education to inform the COVID-19 response for children. Tēnā koe, Jin. Joining her is Dr. Lily Fraser, a GP and Clinical Director at Turiki Healthcare. He uri ia no Ngaitahu, tēnā koe te tuakana. Further north, no Manua me Pua I Savai, ko tākuta Teuila Percival. Dr. Percival is a consulting paediatrician and senior lecturer at the Department of Paediatrics at Auckland University, the University of Auckland. Also supporting us tonight are our sign language interpreters, Laura and Rangi. Tēnā kōrua. What a lineup. I vaccinated my tamariki on Monday, 11 and 8, and we did it, I guess, to protect our wider community. So we're going to start our discussion tonight by asking each of our experts their thoughts, their opinions, and why they're here tonight. So starting with you, Hinemoa, Jin, Lily, and then Teuila.
Kia ora te whānau, no muri whenua ahau, ko Hinemoa tōku ingoa. Thanks for joining us tonight. Well, he taonga te mokopuna. Our tamariki mokopuna are precious, our rangatira moa pōpō, our leaders of the future. And so their safety and well-being is absolutely critical to all of us. We want them to have safe, evidence-based protection, just like the rest of us have had access to, the rest of our whānau. So we don't want our tamariki to be left in the front line of vulnerability to the COVID pandemic. We've already had, very sadly, one under 10-year-old tamariki pass away from COVID, the Delta variant. Karoha kia koutou, kia rātou, ko te whānau pani. So tamariki safety is our utmost priority. And so we've got to navigate this and navigate with some uncertainty. The science that's being reported raises plenty of questions, and as Mihi says, we really all hope that we can satisfactorily answer your questions tonight. We're having to learn to tolerate, aren't we, that we've got to learn as we go, as new information is available, and as the virus does what it's designed to do, which is morph and change into new variants. We've all been very stressed over the last 2 years, and so it's not an ideal state to be making such critical decisions. And again, we're under huge time pressure with Omicron already here. Our tamariki want their lives back, and we want to do everything we can to make sure that happens. So we need to compare and contrast the risks and benefits of the vaccine with the illnesses that COVID causes. We've got to stop thinking about Omicron as a mild disease. Without vaccination, Omicron means many more of our tamariki will be in hospital. Being a sick tamariki in hospital is horrible at any time. But think of it this year, 2022. Few, if any, visitors, lonely, alone, suffering. Tamariki are telling me that they're scared about going to hospital. And vaccination can reduce their fear by lowering that risk. Our tamariki also live in households where there are relations that have many existing health issues. So let's reduce the possibility of tamariki passing on COVID to other whānau. And of course, there's emerging evidence that our tamariki growing up in this pandemic are much more likely to have problems in their development, how they learn to think, how they understand the world, expressing their feelings, their learning, whether or not they've been sick with COVID. I'm seeing huge numbers of tamariki with extreme anxiety and low mood because of the disruption and their perception of danger around them. Vaccination is a vital tool in restoring the structure and predictability in life that tamariki and whānau need. Tamariki mokopuna need the right to have access to this form of health protection. Ngā mihi.
Kia ora, Jin.
Kia ora, everyone. Wow, that was really amazing, Hinemoa. I am a mum of two. I have Chester, who's 7, and Toby, who's 4.5. And as a mum and a paediatrician, and also a child health researcher, I've looked really closely into the pros and cons, the benefits of vaccinating our children, because I'm looking at this as a mum. I've spent a lot of time, over a decade now, working in hospitals and children's wards in Auckland and in Tauranga. And absolutely what Hinemoa says is correct. We do not want to see children in hospital, particularly if we can prevent them being in hospital. The COVID-19 pandemic, COVID-19 looks like it's going to be with us for a while. We really want to get children back to school, back into the activities that they love to do. We need to move forwards. And I see vaccination as a really safe and effective way that we can start to move forwards out of this pandemic and out of lockdowns. And so I really encourage all of you to take your time and to think about the information that we're going to present to you tonight. I don't know what kind of information you've been exposed to, but it's really important to get your information from trustworthy sources and good people who have your best interests at heart and your children's best interests at heart. So I really hope that we can answer your questions tonight. Kia ora.
Kia ora, Lily. I think you're muted.
Kia ora, unmute. Kia ora koutou. Ko Lily Fraser, hau he uri no kaitahu. I'm a GP at Turiki Healthcare in Māori. And so working in Māori in the last couple of years through the pandemic, I've really seen the impact that that's had on our whānau in South Auckland. And we have been caring for whānau with COVID, particularly in this Delta outbreak in the last 5 months, and have really had first-hand experience of seeing the difference that the vaccine makes for our whānau. From, we've had whānau members pass away who were unvaccinated through to hapu mama in ICU, before vaccination was really available, and how unwell people can be when they get COVID. And so I think we need to remember, I really endorse that kōrero about Omicron. The reason Omicron feels less serious, feels like a milder disease, is due to vaccination. That we have had such high levels of vaccination in places like Australia that people aren't getting as sick as they would have if they hadn't had that protection. And so I'm really encouraging people in our whānau, in our hapori around Aotearoa, to consider vaccination, particularly for our tamariki. I think that we've done an amazing job really looking after our kaumātua, and now's the time to actually really start thinking about our tamariki. Yes, it can be mild, but it also, for some of our tamariki, can be a really serious illness that can put them in hospital. And what we've talked about the whole 2 years of this pandemic is that really our biggest concern is that when we, as New Zealanders, need a bed, right? Somebody needs to go to hospital, whether that's related to COVID, whether that's related to another health reason. We want to be able to give that really high quality care that we are used to having. And there is a real risk with COVID that won't be available. And so I think it's, now is the time before the numbers really take off to protect our tamariki. And so I'm really happy to be here tonight to help answer some of your questions. Kia ora koutou.
Teuila.
Good evening, everybody. Look, I'm a paediatrician and I've been a paediatrician for a couple of decades now, and I work in a variety of settings. I work in the emergency department and I work in the wards looking after children with acute illnesses, and I see kids in outpatients. And I guess watching what's happened over the last 2 years, it's very, very clear that COVID-19 is not good for children. It's, you know, we see the indirect harm and we are seeing direct harm as well. And increasingly, paediatricians are worried that children are making up more of the percentage of COVID cases ending up in hospital. And we're really worried that we're going to get more and more severe disease in children. There's a lot of talk out there that says this is a mild illness in children, and what we say is it's not so much mild as less severe in children, but it's still significant. And there are some children that are particularly at risk, and those are children with underlying medical conditions like lung problems or heart disease. And these children have a much higher chance of ending up with severe COVID illness and ending up in hospital or in intensive care. It's very clear to me, just like Jin, I've looked really hard at the evidence. I have a family too. This is a safe vaccine. The safety profile for this vaccine, over 9 million doses given in the US already. It's akin to or better than many of the vaccines that we give out in our normal childhood vaccination schedule. So this is a safe vaccine. It's a really critical thing for us to be able to protect our children from direct harm. So if it's available to us, which it is, then my encouragement to parents is find information, talk to your GP, listen to us tonight, get good information and make a decision for your child to help protect them. Kia ora.
Tēnā koutou katoa, thank you so much for sharing that. Let's just jump in because we've got a few questions coming up, and there's a couple of comments in there that Omicron is actually milder. This is what people are believing. So, you know, why should people vaccinate their children? I want to come to you, Lily, you know, because you're working with lots of vulnerable families. Tell us, you know, your view.
Yeah, so I think that there is individual protection here. So this just isn't about you know, reducing spread or keeping schools open. Those are really important reasons to vaccinate, but actually, as Teuila was saying, this can be very, make children very unwell. And none of us like to see our children in hospital. You know, I have a 9-year-old daughter, and touch wood, she's never been to hospital, and I want to keep it that way. So when I made the decision to vaccinate her, that was part of my whakaro, was about actually the individual protection that's going to give her. In the biggest scheme of things, she hasn't been to school for 5 months. And, you know, the joy that she's had going back to kura, and we're lucky she's back to kura a week early this week. I haven't seen her with so much energy and excitement about life really for 5 months, because she's been living in a little Zoom world. And, you know, that's not a healthy way for our tamariki to work. So when we had the kōrero with her about the fact that she was going to be having the vaccination, we gave her some options around what she wanted to do. Of course, she had it at Tūruki. I said, do you want Mum to get the booster at the same time? And she said, no, I want to do it with my friends. So, you know, that's the kind of things that you can start talking to your kids about, is what is it that's going to make this a good experience for them, and you know, do the best to jack that up for them. So, yeah, I think it's really important.
At the beginning of Delta, we were at the 1 o'clock press releases. I think we were quite engaged with the numbers as they were tracking, and you know, we didn't hear a lot about how Delta was affecting tamariki, but could any of you share, you know, what is the true impact on New Zealand children from COVID? Jin?
It is significant. So in the, let's take the Auckland August Delta outbreak. I looked at the numbers yesterday to remind myself what the case numbers were. There were over 5,000 tamariki and young people that were infected with COVID-19. So those are high numbers. And out of that group of children who were infected, between 1% to 2% of children and young people needed to be admitted to hospital. Now, you might think, oh, well, that's quite low, but the thing is we don't know who those children are going to be in advance. And one child also had to be admitted to intensive care in our Delta outbreak. So we don't know, it's a bit of an unpredictable virus. It can be less severe and manageable at home for the majority of children, but then every now and then it will cause a really serious illness for children and they'll need to come into hospital. There is a rare complication of COVID-19, which I think it's really important for parents to know about, because I think it does, vaccination is shown to be very protective in protecting children from this complication. It's called Multisystem Inflammatory Syndrome in children, MISC. In research studies in the UK, it's also referred to as PIMS-TS. Now, this is a condition that comes on 4 to 6 weeks, typically after a mild infection of COVID-19. It peaks in this age group. So 5 to 11-year-olds have the highest risk of MISC, and it is a serious complication. It causes a fever and inflammation throughout the body organs, including lung, heart, brains, gut. It can be quite significant, and in Australia, New South Wales paediatricians have said that early on in the pandemic, they admitted something like 70% of children with MISC to intensive care. The other thing about MISC we know from overseas studies is that it tends to affect children who are of ethnic minority groups more. So we might expect Māori, Pacific and Asian children to have higher risk of MISC. So even though it's rare, we can't predict who it's going to happen to. It can happen to really healthy children. Now, I'm not saying that to scare you. What I'm saying it because the good news is that studies have also shown that 2 doses of Pfizer vaccine are very protective in preventing MISC. And in fact, in a cohort in France, a published cohort, there were no children admitted to hospital with MISC who were vaccinated, compared to over 30 children who were unvaccinated over a period of time.
Yeah, Teuila, do you want to jump in there and talk to us about, it's a big decision and the balance of, do I vaccinate or do I stand the chance of my child, suffering from a disease or a condition like this? What is your advice to whānau?
I think what Jin said is really important. This is an unpredictable virus, but we know some children are more at risk of more severe illness. And I guess for parents, they're weighing up, if my child gets the virus, what's going to happen? What's the risk to them? And balancing that with what is the risk of the Pfizer pediatric vaccine. And I guess if I just give parents an example of something we do already. So we have a vaccine for rotavirus, which we give to all children in New Zealand to protect them from a really nasty diarrheal illness called rotavirus, which causes diarrhea and vomiting. And about 2% of children who get rotavirus end up in hospital. And some children, really, really sick, like preterm babies or some children with disabilities, will get very, very sick with rotavirus. But most children, not too bad, they're just a bit miserable for a few days at home. And we vaccinate children against rotavirus, and people don't seem to mind vaccinating for that condition. The risk profile for the rotavirus vaccine is it's worse than the Pfizer pediatric vaccine. So 1 in 100,000 children who are vaccinated against rotavirus will get a condition called interception, which is a serious condition involving the bowel. So if you compare the risk profile of rotavirus with the Pfizer pediatric vaccine, what we know from the States, so almost 9 million doses given out in the US, and the serious adverse events following that seem to be very rare. There have been only 11 cases of myocarditis, which is what everyone's worried about, reported in the US in 5 to 11-year-olds out of that 9 million doses. So myocarditis, just to explain for those who don't know, is an inflammation of the heart. And this seems to be the thing that most parents are worried about because it's been reported quite a bit in social media. And what we can say is, in those 9 million doses that have been given out in the US, only 11 cases have been reported of myocarditis. And those children actually have mild to moderate illness, and most have recovered, the others are recovering. So I think as paediatricians, we're pretty comfortable that this is a safe vaccine, safer than what we are currently using in our children for other conditions. So I think if you weigh that up with the risks that Jin has talked about, it's probably not an unreasonable thing to be thinking about protecting your child with this paediatric vaccine.
It's really interesting, isn't it, Hinemoa, when we are used to giving our kids measles, mumps, rubella, diphtheria, rotavirus, but when it comes to this, it's such a different decision. What's happening for us? What's happening for whānau?
Yeah, look, the things that whānau are telling me is it's about the time scale. You know, I was also looking at the measles vaccine and thinking, wow, you know, we've been vaccinating kids against measles since the late 1960s. But I think it's because this has all happened so quickly, and the sheer number of changes that we've had to try to adapt to has been overwhelming for people. So I think it highlights that this is not only an infectious disease, this is a disease of all aspects of child development, of whānau experience, of mental illness, of physical illness, of spiritual well-being. So all the things that we know help keep kids well, feeling safe, having fun, having a good sleep routine, eating healthy kai, going into te taiao, all of these things, having their schooling, their friends, their teachers, all of that's been so disrupted, that fabric of their lives has been really ripped up, and that has impacted on the ability to make decisions, the ability to kind of weigh things up as we might prefer to do, but we are, as I said at the beginning, we're under so much stress and pressure. And parents are, you know, the parents that I'm seeing are feeling that they just don't really have the skills, that they don't have the handle on it. So the people that they trust to talk to also might not have all the answers. So people are feeling a little bit that they're not really finding the support in the places that they need it and when they need it. And as Jin also mentioned, you know, trying to bide some time at the moment to just sort of slow time down so that people can get their head around making the right decision for them is another factor. I also want to mention that we need to make sure that we don't stigmatise or punish people who are taking their own good time to come to the right decision for them and their whānau. And there will be people who right at the minute just feel like this is too hard. And there will be other people who are much more kind of fluid and moving towards considering it. So I think it's also really important to remember that as communities, we are compassionate for wherever people are at with that decision making. And I also wanted to mention a couple of other illnesses that COVID causes, and we don't really know the levels of post-traumatic stress disorder that our tamariki mokopuna are having, as we've heard, huge numbers last year, and there will be more. So that's another aspect that we're in mental health services. Certainly we've seen some of that already, but we're preparing for more. And then there's this entity called long COVID, which is increasingly going to impact on our children and young people. And that's a syndrome that again seems to develop maybe 4 to 6 weeks after an infection with COVID, and can last months. And obviously we're waiting to see how long that might last for some of the people who got COVID way back at the beginning. And that's a real worry to all of us, and you know, who are interested in child and adolescent development, is that layer of interference with how people experience well-being.
Yeah, it's a lot. As of today, 124,000 tamariki have been vaccinated in Aotearoa. But for those, let's talk strategies now for some parents who are, you know, want to get their kids vaccinated, but their kids have extreme anxiety. You know, have you got a message for Vicky? She's asking, I've got 2 6-year-olds who are terrified of needles. Any suggestions?
Well, I could kick off a few things. Number one, Vicky, the needle is much, much smaller, than it's given for the adult vaccinations, and the amount that's given is smaller. There's lots of really great stuff online about how we can, as adults, parents, caregivers, set our tamariki up for a better experience. We need to manage our own anxiety, try not to use sort of things that might be a bit minimising, like, oh, you'll be fine, to acknowledge that it is a big decision for them and it is worrying. And to, you know your sons better than anyone else. They might be the kind of guys that need quite a long lead up time, or they might need just some prep just the day before or even on the day. Take lots of distractions. I'm sure my colleagues will have lots of other ideas, but this is a conversation we're all having with many of our patients and their whānau.
Yeah, Lily and Teuila, what are you experiencing?
Should I jump in first, Lily? What I tell parents is, just as we've heard already, to take time and talk to your kids, talk them through, be real honest, and but you can make it a way that's manageable for kids. If you can say it's going to hurt, but it's only going to hurt for 1, 2, 3, 4, finish. That's how long it takes for the needle. Then it's finished, and then you get to go away and you have a cuddle with mummy. So it's about giving the kids some way to manage the scariness of it, so if it's going to hurt just for 4, most kids can cope with that. And then, lots of distraction things, lots of rewards, and take them for a dry run if needed. There's no need to push kids. They can go and have a look, see that the nurse is really nice, come back again another day.
Yeah, what's your advice, Lily?
Yeah, I think that, you control the things that you can control. And so giving the children options around what they want the experience to be like, using things like ice, that cooling down the arm takes away from the fact that there is some pain. Before I took my daughter, we were fortunate that our friends in Canada had their children done beforehand, and they had videoed that. So she watched the video, and thankfully the little girl said, oh, it was just a pinch. And, that was really effective for Tui, because she was like, oh, well, it's just going to be a pinch. I think, you can think about headphones. Are you going to have something that's going to distract them? Is it their favourite toy? But I think being honest about what is going to happen, and then controlling the things that you can control. And, I'm always in for a bit of a reward afterwards, choosing something that they love, that you're going to do after it's happened, because, their arm isn't going to be that sore straight away. It's often a bit later. We also used a pain scale with, so I took my daughter and my niece, and, they're both 9. So we said, well, what do you think it's going to be? And my daughter thought it might be a 3 out of 10. My niece thought it was going to be a 1 out of 10. And so you could see my daughter going, oh, maybe it's going to be 1 out of 10. She went first, and she was like, oh, it was a 1 out of 10. And so, of course, my niece was a 1 out of 10. And, I think it's okay to involve them in the conversation about what the pain's going to be like.
Okay, Jin, sorry to give you the difficult questions, but there's a question there. I know we talked about myocarditis, but what are some of the side effects for tamariki?
Yeah, that's a great question. So Teuila spoke a little bit before about myocarditis and how it is a very rare side effect of the Pfizer vaccine. And the most important thing, the first thing that I want to say is that if you're worried about myocarditis in your child, it's actually better to get them vaccinated, because COVID-19 infection itself can cause myocarditis. Lots of other viruses that children commonly get in childhood can actually cause myocarditis, and COVID-19 infection is one of those viruses. It causes about 4 to 6 times more myocarditis than the vaccine would. But if you were worried about your child and any side effects that they were having after they've had a vaccine, please see your GP. Myocarditis itself, incredibly rare, but good to know the symptoms. So children describe symptoms of myocarditis differently. It's an inflammation of the heart, and the 3 main side effects are, the 3 main symptoms, are shortness of breath, chest pain, and palpitations. But children don't tend to come to you and say, I'm having palpitations. One child that I've seen who's had myocarditis told me that they had butterflies in their heart. This wasn't vaccine myocarditis, mind you, this was just viral myocarditis. They said they had butterflies in their heart. Another child told me that they felt like they had an elephant sitting on their chest. So, of course, if there were any side effects, if your child was saying things like that to you, you would want to get them checked out by your GP.
Papai, Lily, jump in.
Yeah, I think we've been in this really actually privileged position in Aotearoa where we haven't had a lot of COVID in our face. And so we've had these really amazing public health measures that have actually meant that the number of us that have had COVID has been really low. And so when people have been weighing up the decision of, do I get a vaccine or am I going to get exposed to COVID? It's been, well, I'm not really going to be exposed to COVID. So then it's looking at that individual kind of, the risk doesn't feel so big. But, what we're being told and what we're preparing for with Omicron is that we are all going to get exposed to COVID. And how our immune system deals with that is going to be dependent on a number of factors, particularly whether we've been vaccinated. And so I think this idea that we can hide away from COVID, that the risk isn't going to actually affect me as an individual, we're now in a different era of COVID. And so I think there is, I don't know how real that's feeling for people yet. I know that some people have really got that message, are preparing or feeling worried, and then other people maybe haven't got the message or just take it in their stride. And so I think we need to really be preparing for when we get COVID or when we're exposed to COVID, rather than if we are.
Just quickly to you, Hinemoa, I just want to talk about those two different messages. So Jin was talking about, actually you can get myocarditis from COVID, and it's, and it's not as rare as getting it as an adverse reaction to the vaccine. Why do we only hear one side of that? What's happening with our messaging, and how do we change that?
Yeah, I think it's the influence of a range of factors, as Lily's been pointing out. We've been kind of having this rarefied experience, and it hasn't been made real for many parts of the country so far. So sometimes the extremes of reading side effects from a vaccine have more salience for whānau. They hit those hot spots, if you like, psychologically, compared to hearing about, well, actually from COVID, your risk, especially if you're a young man, your risk is much higher, perhaps 6 times as high. So we don't tend to weigh these things up in an even-handed way. We tend to draw into the perhaps more negatively charged, more the fear factor, if you will, tends to create that potency of that information in our minds.
Kapai, I'll come to you, Teuila, because Lily talked about we all eventually will be affected by COVID or come into contact with it. Can you talk to us about how the vaccine will help you if you're vaccinated?
I guess what we know about people who've had vaccination, and particularly two doses, is that their illness is going to be much less severe if they do in fact have an illness. So it's going to protect them from, I guess, the serious effects of the COVID virus. And I guess what we know, I think we've been relatively protected in New Zealand, and what we know from some quite nice studies recently published is that the COVID virus can in fact be a significant infection in children. So there's been a recent study published which there was a New Zealand paediatrician who was part of the publication group looking at children who came with definite COVID to emergency departments. And out of that group of over 3,000 children, 3% of them had severe illness, severe enough to end up in intensive care and need some sort of support, either with a ventilator or drugs to support their cardiovascular system. So I think it was a really nice study because it was very clear they were only looking at definite COVID cases that came into a hospital with definite diagnosis. And it really tells us that this can be a significant illness in children, and it's not something I think to be taken lightly. And we've been relatively protected in New Zealand, as you've heard the others speak of. So for me, I think it's something which we're learning more and more about, and increasingly, I think, because more and more adults are vaccinated, we're seeing more and more disease in children. So we're getting more experience, unfortunately, with children. So I certainly take the point that Hinemoa was saying, that we're learning a lot as we go. But I think what we are learning from what we've seen with what's happening in America and Australia is that this is a significant and increasingly significantly serious illness in some children, that if we can protect them from that, then it's something which we should strongly consider as parents.
Kia ora. I just want to, can I just address this question from one parent? They are worried about vaccinating their disabled child, and that this might impact on that child's disabilities, and they're weighing up whether they should, if vaccinating the rest of the whānau is enough. Jin, do you want to jump in there?
Yeah, kia ora. So I'm thinking of you. I look after children at Starship who have disabilities. That's my patient caseload, and I see children with disabilities in clinic every week. I know it's a difficult decision, because as a mum or a dad, you don't want to do anything that might compromise the health of your child. And this is where I come to exactly what Lily said. We do expect that despite our best efforts, almost everybody is now going to be exposed to Omicron. And so what we need to do is to protect children from becoming seriously unwell. Children who have disabilities, when they do catch COVID-19, have a much higher risk of needing to be admitted to hospital. In one large meta-analysis, so one very big study, they found that it was something like a 20 times higher risk if your child had a serious disability that they would need to be in hospital and admitted. And so what I'd say is this is, again, a very safe vaccine, and I've been recommending it to everybody. In fact, our paediatric cardiologists at Starship made a video to share with their whānau that they see in clinic, our heart kids, saying it's really important, even for our children who have heart conditions, to be vaccinated to protect them for this very reason. Now, there's some whānau out there who have children with disabilities where it's actually quite a challenge to get children to come to a clinic and to be vaccinated. And what I'd say is there is a dedicated disability team at the Ministry of Health that can help with this. You can call the number 0800 28 29 26 and push 2 and speak to someone and they'll help you, or you can text for free to 8988 and they will text back and help you. Or if you go to the bookmyvaccine.nz website, you can tick a box to say that you have a child who's disabled and you need more help. And we are trying to reach everybody. So I do trust that if you reach out, you'll get the support that you need.
Kia ora, and just some just quickly, actually, Teuila, you can answer this one and then answer that one. Someone wants to know if their children will eventually get a My Vaccine pass, and if they'll have to do boosters as well, and then jump in.
We don't know yet about boosters for children. What the studies are telling us at the moment is that children have a very good immune response just with 2 doses, and at the moment we just don't know yet about the need for boosters. My vaccine pass, I can't really answer that. That I guess is a ministry question, but that said, children's vaccination status will be uploaded into the system, so it'll certainly be recorded. But I just wanted to add on to what Jin was saying. I have a grandson who has a disability, and he has autism and an intellectual disability, and for him to get vaccinated, we just basically took our time. He looked at lots of things so he could see what would happen, and he has this. He really loves our Prime Minister. He loves watching her on TV, and when he saw her get her vaccination, that was a great sort of encouragement for him to have his vaccination as well. So I just would really reach out to any family or whānau who have disabled young people or children. Just take your time and find what suits your child or young person. And as Jin said, reach out to paediatricians or others in the team. We're always there and very willing to help.
I can answer the question on behalf of the Ministry of Health. Yes, your child will be eligible to get a vaccine pass when they turn 12, once they have had the full paediatric dose. So that's the answer to that one. Hinemoa,
I just wanted to toe top of what we've heard. I look after children who've had traumatic brain injuries in their whānau, and we also have fantastic Māori providers who, for our whānau, we know that's often the resource that our whānau feel most comfortable with. So making sure that, we live the statistics. Our tamariki Māori do have a large number of complex, dynamic health problems that make them more at risk of having a nasty illness if they do get COVID. And one other thing to be aware of, at the moment, the schedule says that the second dose comes 8 weeks later. But there is provision in what's being advised through the Ministry of Health that if your child does have some complex medical issues, that you can have a discussion with your health professionals and see if the 3-week period might suit you better. I just want to highlight that, especially for some of our whānau Māori.
Yeah, not all of us have an auntie who's a paediatric doctor like you guys. So here's a question for you, Lily. Hine, she asks, my 13-year-old refuses to have his vaccine shots even though my household of 3 adults and 3 children have had our shots. He won't do it. All the pros and cons about the vaccination have been made, but he won't do it. What should they do?
Yeah, I mean, ultimately, I'm really don't support forcing anybody, and I do think that we need to respect everybody's right to be informed in their decision and give consent, and that applies to our tamariki as well. And so I think ka pai you guys for letting him take his time, and I think the important thing is to just be willing to be there and to answer his questions if they come up, continue to have positive kōrero about the reason why, as a whānau, you think vaccination is important, and hopefully with time he will come to make his own decision.
Ka pai Jin, Emma's daughter, she says, shall I wait until my 11-year-old turns 12 in June and get the adult dose, and he's 40 Ks?
Yeah, I get this question a lot. I'd say don't wait now, don't delay, because Omicron's not delaying. Omicron's going to move really fast, and after children have had that first dose of vaccine, they do need a couple of weeks for their immune system to mount a good immunity response. So I'd move now. If you're worried that your child's bigger and maybe they won't mount a good immune response because maybe they need a bigger dose, just be assured that the reason for the smaller dose is not based on size. It's actually based on how good an immune response children can mount. Our immune response wanes with age, but children actually have very strong immune systems for the most part. So be confident that the trials have shown that children who are 11 can mount a very good immune response, and that study included children of all sizes.
Teuila, Leanne asks, can she get her 4-year-old vaccinated? If not, why?
At the moment in New Zealand, the COVID vaccination is only licensed and approved for 5 to 11-year-olds, so not 4-year-olds yet. There are certainly studies overseas where they're looking at vaccinating and studying the effects on younger children, and it's likely to, I guess, make its way to New Zealand. So just wait. When they turn 5, they can get vaccinated then, but it may well change in the future. I expect it probably will.
Ka pai, Hinemoa Ngāwai asks, do you have any advice to do anything before they get their jabs, like drink wai Māori?
Great question. Pātai rangatira, thank you. Absolutely. So hydration is important. I was also going to say, make sure that you've had a good sit down and chat with your tamariki about, so that they understand all the steps that are going to happen and why they're having the vaccine. You're going to learn something about their understanding, and that's a powerful part of building your relationship with them and of supporting them to have a really positive experience. So yes, why Māori, and there might be people out there who want to use some rongoā on the area, let them know. It's likely to be sore. For some tamariki, they don't even feel it. And for others, it is quite sore, often the next day or the day after. And you can reassure them, depending on their age and stage, if they're into cartoons or Transformers or whatever, you can draw on the things that they know well and say, hey, it's creating that protective shield, and the soreness in the arm and the feeling a bit tired and having a headache. Those are all signs that your immune system is learning how to fight when your body meets COVID. So yes, definitely use the wai Māori.
And another quick one for you, Hinemoa, is COVID's just like a flu or a bad cold. What do you say to that?
That is not consistent with the information and evidence that I've been reading and that we've heard from our colleagues tonight. It might be that some kids are lucky and have that experience, but we can't predict the ones that won't have that experience. We can't predict the tamariki. Overall, we have some idea, the ones who already have pre-existing health conditions, but in general, it's hard to pick out the ones who are going to have a more challenging course. So yes, there may be some that do have a flu-like illness and that's it. But that's not a reason to not vaccinate.
Hey Lily, if mum or dad can't get off work, can a family member take the child along?
I think you can do your consent by phone. Jin might know a bit more about that, but my understanding is that there are ways that whānau can be the, kaitiaki and take the children, but the parent or guardian still needs to be able to give the consent.
How do they arrange that, Jin?
My understanding is consent can be given over the phone.
Cool. A question for you, Teuila. Teresa says there's lots of people want to know this. Could you please tell us about the long-term safety data of this vaccine for our tamariki?
Well, I guess what we're looking at with the 5 to 11-year-olds is that we started vaccinating children last year, sort of September, October, and the safety data to date is very good. It's not dissimilar to other vaccinations that children get. In fact, it's probably better in many ways. But we are really, it is a time thing. We are in an epidemic, which is why we're gathering information as we go. And that's often the way with vaccinations. So we have safety monitoring all the time. In New Zealand, we have CALM. In the States, they have another organisation. In Australia, it's also the same. And anything that doctors or families note can be reported and monitored by these groups and also investigated. So we're always monitoring. What we're seeing so far is that this seems to be a very safe vaccine, as we've already discussed. But I think just be reassured that we're monitoring. There have been millions and millions of doses given out in the States in particular already. And the safety profile so far looks very good.
I'll just add a little bit to that. Just to build on what Teuila's saying, I think it's important for people to know, no matter what you've heard from Facebook or elsewhere, there is no way that this vaccine can alter a child's DNA or their genetic material. It does not get into the nucleus of the cell where the genetic material of the child is. It doesn't do that. In fact, the vaccine itself and the contents of the vaccine has 4 components only. There's the mRNA protein, there's a little fatty layer around that to keep it safe, there's a bit of salt and a bit of sugar and a preservative to keep it stable in the fridge, and that's it. And you can find those ingredients on the Ministry of Health website. The vaccine itself doesn't contain any live virus either. It's a non-live vaccine. And with non-live vaccines, we have decades of experience using non-live vaccines. And we find that what happens is the vaccine itself, and this is the case with the Pfizer vaccine, the vaccine goes in and then it's completely degraded in the body within a few days. It is not there anymore. You cannot find any trace of it anymore because your body has dealt with it and degraded it. And what you're left with is the immune response, and that takes several weeks. But once that immune response is finished, and that's very predictable and we can study that, there's really no ongoing adverse effects, no side effects come up years down the track with non-live vaccines. So I want to reassure people there have been no corners cut with the making of this vaccine. It has gone through all the trials that medications and other vaccines typically go through and is found to be very safe.
I just come back to you, Hinemoa, because someone was asking about comparing the adult vaccine to the vaccine for tamariki. I think you mentioned earlier that about the needle. So do you want to talk to us about the difference?
Sure. So the needle is much smaller, and the amount, the actual volume, is about a third of the adult vaccine. So it's a smaller amount going through a very tiny needle. So as I say, many tamariki are saying to me that they couldn't even feel the pinch or the little scratch, as it's sometimes described.
Lily, a few people are asking about children with asthma. I also have a child who had asthma earlier, and the paediatric nurse who jabbed him suggested that I went and got all of his medication in advance, and I thought that was a really good idea. But do you want to share your thoughts around tamariki with asthma and COVID?
Yeah, just like any virus that affects our lungs, which COVID can, it can make asthma worse. And so we do want to make sure, I think that's really good advice, Mihi, to have your asthma inhalers ready now. And if your child has been prescribed a preventer inhaler that they take regularly morning and night, I'd really encourage you to get into the habit of doing that regularly now so that their lungs are in a really optimal, uninflamed condition. They haven't got swelling in the lungs now, so that when they get COVID, or if they get COVID, there is less kind of reaction from the asthma. And so I think that's really important. That's things we can do right now to optimize, but also that the vaccine gives them that added boost so that their immune system is already primed and ready to meet COVID at the door and knock it over, so that hopefully your kids don't even get sick at all, or if they do, it's really, really mild.
Teuila, do you have any advice for children with allergies?
Just to add on first before I answer that, the question that Lily answered, I think it's really important that children with significant moderate asthma do get vaccinated, because we know that if they get COVID that they can get very, very unwell. So it's really important that those children, they're one of the groups we want to protect if at all possible. And sorry, what was your other question?
Around allergies, if there's any advice around that too.
Right. There are no actual contraindications to this vaccine. As Jin was saying, it basically has the mRNA, which degrades. It has some salts and a little bit of lipid to make it stable, and a bit of saline, and that's about it. So there really isn't anything that children with other allergies are going to react to. So you know how children are advised not to have the measles vaccine for a particular reason, or a drug for a particular reason. With this COVID vaccine, we know it's very safe. There's just about no contraindication for any child not to receive it.
Kapai, someone's asking how to report an adverse reaction, and I can tell you that. You just Google Centre for Adverse Reactions Monitoring, which is CALM. It's online and you can fill out the form or call them when you do. We've got a few minutes left, and I wondered if we'll end with just you all telling us in about 1.5 minutes each your message to your communities. Jin?
Well, thanks everyone for listening. I think it's really important that we move forward from this pandemic. Our children are relying upon us to make good decisions for them. And the way that I see us moving forwards and not having to go back into lockdown is just to become a really protected country. We've got really great vaccination levels in our older age groups. Our older age groups are getting boosted and protected, and we want to do the same for our tamariki. My boys, my eldest was vaccinated. He had a sore arm for a day and then it went. He was a real champion. He was a real trooper actually, and he was really chuffed with himself. When he came out of the vaccine clinic, he was really happy. He knew he was protected, and he's off to school in a couple of weeks' time. And my little one, who's 4.5, he's waiting for his turn. So I think it's important to talk to your child and say to them, we do get vaccinated. It's not just to protect you, but it's also to protect our community around us, our grandparents. We want to keep grandpapa and pawpaw safe. We also want to protect those in our community, including some of your friends who are more at risk, that if they got COVID-19, they'd be sicker. But we do this to protect you. And, if you can count to 4, if you can count your age, you can do this because that's how quick it is. And let your tamariki surprise you with their maturity and their ability to do this. If you need any help, we are here. If you have questions, we're here. So please reach out to your GP or your paediatricians or your health professionals.
Hi, Lily.
I think just echoing those same thoughts, and I think that I would encourage you to not delay. And I know that some people want to just have a bit more information, but I really do feel confident that we've got enough information here to feel safe about this vaccine. And we are, within a matter of weeks, going to see a really rapid rise in COVID cases. It's going to be something that we haven't experienced before. And I think that as doctors, we are really bracing ourselves for what that is going to look like in our mahi. We really want to be available and ready and have beds ready for those that need them. But we know that actually it's going to be a real struggle to be able to continue to do the mahi in the way that we like to do it. And so the more people that are vaccinated, the less people are going to be hospitalised. And I think that there really isn't time to delay on this. I've heard some people say that they're struggling to get a booking. I hope that there is a drive-through, walk-in, drop-in centre close to you, and that you can just make that, take the opportunity to just turn up and get it done. Kia kahara koutou. Really think about it, talk about it, and then please do the mahi.
Kia ora. Teuila.
Just echoing what the others have said, and I guess with Omicron, I do want to just warn people that, Jin and I and other paediatricians are hearing from our colleagues overseas that there is a bit of a fallacy that this is a very mild illness, and what we are seeing, I think, in the child population overseas is children are making up a bigger proportion of people who end up in hospital with the Omicron variant, and it seems to be an upper airway problem in particular. So I just do want to sound a note of caution that we do need to take this seriously. It's not necessarily a mild illness to ignore. There are lots of things for us as parents and families, adults and paediatricians that love kids. There's lots of things for us to worry about. And if we have a safe vaccination, which we have with this Pfizer pediatric vaccination, then it's something that we should offer our children. I firmly believe that children have the right to protect themselves and to be part of protecting the community and their family, which is what happens when kids get vaccinated. So I just want to really encourage parents to take their time and reach out and gather that information, but be aware that this virus is in our community now, and I'm really concerned as a paediatrician that we're going to start to see some really sick kids coming into our hospital. So let's get on, as Lily said, and protect our children.
Kia ora, Hinemoa.
Ai, tautoko marika. let's not leave our tamariki out in the cold, where they're going to be vulnerable. They're part of our whānau. They can feel the greatest sense of control and participation, as others have mentioned, in their own well-being, in this fight that we're all in together, in their own particular way. And it's about whānau oranga. So for the adults, go and get your boosters, and maybe organise to get your boosters at the same time as your tamariki getting theirs, if that works for you. But I think adults getting their boosters is also something that I want to emphasise in the context of the importance of our tamariki accessing vaccination too. Kia ora.
Kia ora. And so what we know is, 124,000 vaccinations, but unfortunately Māori and Pacifica are lagging behind the general population. So, we've got a really amazing, diverse group of wahine mamas, and not only mamas, medical experts as well. So if you're watching this and you've got a daughter or a niece or a nanny or somebody who's caring for tamariki, then share it. Later on tonight it'll be up on the Ministry of Health's Facebook page. Share it wide, because these experts are talking directly to your communities. Tēnā koutou, thank you so much for joining us and bringing us all your wonderful knowledge and information. Tēnā kōrua, rangi kōrua, kōlora hoki. Thanks for joining us. Nai te rā.